Well, if you're just waking up in the morning, you are hearing now about a lawsuit that's been filed against the state of Illinois by retired school administrators, retired teachers, and staff over insurance costs that the state of Illinois is pushing on to teachers that are retired from the profession. And we've got several voices joining us, so please bear with us on the WMAY morning news feed as we patch everybody through here. I'm Greg Bishop, now 7:39, and joining us on the line, we've got Bill Funkhauser, Jim Bachman, and Pat Hampton. I believe I've got everybody here with me. If you could please introduce yourselves. We'll start with Bill. Go ahead.
Yes, this is Bill Funkhauser. I'm president of the Illinois Retired Teachers Association. And with me right here this morning is Jim Bachman. Jim?
This is Jim Bachman. I'm the executive director of the Illinois Retired Teachers Association.
And I believe we also have Pat with us on the other line. Pat, can you hear Bill and Jim?
Yes, I can.
Fantastic. Well, go ahead and introduce yourself. And real quick, Bill and Jim, can you hear Pat?
Yes.
All right, so we've got everything. I just wanted to make sure while we're live here, just making sure that we've got everybody that you can hear each other and you can hear me. So greatly appreciate it. Pat, go ahead and introduce yourself. How long were you in the profession?
I was in the profession 34 years.
Great. Wow. It's a good time. And thank you for your service to probably what's one of the most difficult jobs anybody could take on, and that's being a teacher. So let's go ahead and jump into this. You guys filed a lawsuit against the state of Illinois. Bill, give us the upshot here. What's this all about?
This is about simply health care for retired educators.
And what are some of the parameters that are involved with suing the state? Why are you guys suing the state?
Well, the CMS requested that the contribution to the fund be reduced, which is going to lead to the fund becoming insolvent eventually and puts our health care in jeopardy.
So essentially, the state has decreased how much money the state's giving to this insurance fund that provides services for retired teachers and administrators.
Yeah, this is Jim Bachman. Yeah, what they ultimately did is the Central Management Services asked the TRS board to certify what the formula is and reduce the formula amount that ultimately not only reduces the state portion, but the active teachers portion and the employers or the school districts portion that, approximately means, around $100 million reduction to the plan.
So $100 million, is that per year or is that over time?
It's $100 million per year that it will be this first fiscal year of FY23. It'll be a reduction of approximately $100 million. And under law, there's a maximum that it can only raise 5% annually. So obviously, the increase would just be a slight increase over the next X amount of years. So our actuary has come forth and said anywhere between 1 to 4 years that the fund could go belly up.
So we're talking about a service that is owed to retired teachers. How's this impacting somebody like Pat, for instance? Pat, tell us how this would impact you as a retired teacher.
Well, I would have so many out-of-pocket expenses that now are covered by my insurance. For example, I was in the hospital twice this last year. Not only my hospital stay, but doctor's appointments and also medicines. They would be out-of-pocket expenses that I would not be able to afford. It just would be devastating to me. I depend on that. When I go to the doctor, I have a copay of just a small amount, and the insurance covers the rest. It would just be financially, physically, mentally, so many ways, just devastating to me.
We're talking with members of the Illinois Retired Teachers Association here on the WMAY morning news feed. A lawsuit filed today against the state of Illinois about insurance and increasing costs for retirees, decreasing the taxpayer cost here. Jim or Bill, could you tell me, is this in line with the concept of the Constitution not allowing for the diminishment of benefits? Is that kind of the angle you guys are using here?
Yes, we feel that our health care is part of our benefits that we receive, and under the clause it says our benefits cannot be diminished, and we think this would be a diminishment of those benefits because we would then have more costs on our own, and also, I'm assuming, much higher premiums.
What's the rationale that you guys, as beneficiaries of this product, this insurance product, what's the rationale you've been given by CMS as to why this is happening right now?
To be honest with you, I don't think there is a rationale other than saving money for the state.
And they anticipate saving how much out of this?
Approximately, starting off somewhere between 40 and $45 million annually, but slowly would be decreasing over the years just because of 5% increases. But the first year out of the shot, somewhere between 40 and $45 million.
So, how quick is this going to be implemented on retired teachers if your guys' lawsuit doesn't hold things up here?
Well, actually, I mean, the TRS Board of Trustees passed that certification. It'll take effect July 1st of this year.
So, we're talking just in a handful of months. This is going to be realized in the forthcoming budget cycle.
Correct.
Have you had lawmakers discuss this with you? Have you talked to legislators and how they handle this moving forward? Because budget season's upon us, right? They're going to be talking about where to spend tax resources on what. Has this been something brought to their attention, or is this something that is kind of baked in at this point?
Honestly, we haven't spoken to any legislators. You can look at previously the General Assembly is funded in the manner it should have. So we wouldn't, doubt that the General Assembly wouldn't have funded it in the appropriate manner if the state and the city CMS wouldn't have acted in a different way, irresponsible way of reducing that formula. So I'm sure the General Assembly would act accordingly.
We're talking with Jim Bachman, also Bill Funkhauser, and Pat Hampton about a lawsuit filed this morning against the state of Illinois from the Retired Teachers Association concerning health insurance costs. And what is the status? I know some state retirees get fully funded insurance. Is that the case for teachers right now?
No, retired educators pay approximately 25% of the premium, and then obviously the active teachers and the school districts in the state of Illinois pays the other 75%.
So, what are you guys looking for to temporarily block this before it's implemented at the beginning of the budget year this summer, or are you looking to have this dropped altogether entirely?
We're not looking, we're not asking for a TRO or any temporary block or anything like that. Ultimately, we're just looking for the fund to be funded in the appropriate manner going forward, and that retirees receive their health care that they were promised and guaranteed.
So the next steps here, what do we anticipate happening? I imagine, with the way court cases go, you could have status hearings, you could have oral arguments. Where do you end up seeing this thing ultimately go?
I would just, I wouldn't tend to guess, but ultimately I would think that we'll probably be back in the Supreme Court at some point in time.
And the Supreme Court's taken up several of these types of post-employment benefit issues with how they've ruled in the past. What's the sentiment that the Illinois Retired Teachers Association has moving forward? Do you think the chances here are good that they'll see it your way?
Well, we would hope so. Just with the pension lawsuit and past cases, we feel we wouldn't have moved forward on this lawsuit if we didn't feel that we had good standing.
Any last words from either Jim, Bill, or Pat? How this would impact members moving forward, or what you ultimately think that the message should be to those who are making these decisions at TRS or beyond?
We have a group of retired educators who spent their life educating the children of Illinois, and now in their retirement, they looked to have their health care provided as they were promised, and it's being threatened. And we simply want it done in the way we expect it to be, and the fund have the adequate amount to see through any claims that are filed by our members.
Jim, any last parting words here?
No, I more than anything, this is about health care. This is about, retirees in the most vulnerable state receiving the health care that they've been promised.
And then Pat, as a retired teacher, kind of reiterate how this will impact you if it is not found unconstitutional, I guess.
Well, it will just devastate us. And another thing I want to just say that it inspires me to get more people to join our efforts, because the IRTA has been fantastic. In our previous lawsuit that we won, had to go all the way to the Supreme Court. I'm going to go out there and try to get more members to get us behind this effort to support the IRTA. We have to win. We have to win. This is an effort that we cannot let go. We will be devastated if it does not go through. Retired teachers don't make all that much money, and they cannot be paying for their own insurance. They cannot be paying for their own health needs, because it's too costly. They keep going up. It was promised to us. We deserve it. We need to have it.
That was Pat Hampton. We also heard from Jim Bachman and Bill Funkhauser with the Illinois Retired Teachers Association, a lawsuit filed this morning against the state of Illinois over the cost of insurance. And we'll likely watch this all the way to the Illinois Supreme Court. Thank you so much for taking time with us, everyone, and have yourselves a great day and stay safe out there.
Thank you.
Thank you.
It is the WMAY morning news feed now at